Okay, so the big day is finally here. Let's talk about what to expect on the day of your Artas procedure. On the morning of surgery, we're going to take a look at you ahead of time. We're going to take a look at your hairline, review any wish pictures or old photos you have of your previous hairline. And then together we're going to decide what your ideal new hairline is going to be. We're going to map it out for you. We'll show you in a mirror, make sure that we're 1,000,000% on the same page. Then we're going to give you a little bit of a shorter haircut, kind of like the one I like. And we'll then go ahead and get you prepped and ready for the extraction and eventually the transplantation.
So day of procedure, it is a full day procedure. After Dr. Obaid gets you marked, we come up with your perfect hairline. Then we're going to numb the area. Everyone's worried that it's going to be painful. The process should truly be pain-free, maybe a little bit of pressure.
The numbing's the worst part. Sorry.
It is. That is true.
That's why she gets to do it.
I know. The injection numbing is the worst part. Then we do the harvesting. The harvesting is where we are extracting the hairs from back here. You'll be face down during that portion of the day. Most men fall asleep, listen to music, listen to a podcast. Dr. Obaid's in there checking on you, doing videos the whole time. It's really a pretty easy part of the morning.
And let's dive into the harvest a little bit, because this is where the Artas robot technology really makes the big difference. The Artas robot is going to scan your scalp and each specific hair follicle 60 times per second to make sure that it has the absolute perfect angle to pull that hair out without damaging it. Even a 5 or 10 degree miss on the angle when we extract the hair will permanently damage it and make it so that it doesn't take when we transfer it. Now you say 60 times per second. How does that compare to the human eye? The human eye can scan each hair about 10 to 12 times per second. So the reality is the Artas robot is going to be anywhere from 5 to 6 times more accurate than I'm going to be, than Charity's going to be, or anyone else can be in terms of extracting that hair. We really have reached the point where technology is so much further ahead than human hands. In addition to the accuracy with which it extracts each hair, there's a key factor here where it doesn't leave any trace behind that it was there. So when we look at the different hair transplantation technologies, the biggest thing we want to do is make sure that you can't tell that we took hair from somewhere else. Now, in the most basic hair transplantation technologies, the strip method, where people actually cut the hair out by hand, you'll actually see a linear scar that's there forever. We don't want that. We want you to be able to wear short hair and not see that something has happened. If someone is offering you a linear scar technology, you gotta run. That technology is 30 years old. We don't want to do that anymore, okay? Number two, we don't want to use hand extraction like NeoGraft, PureGraft, or any of these other hand drill technologies. While the surgeons will brag to you that their hands are great, etc., the fact is this: that camera scanning 60 times per second is so much more accurate than any surgeon's eyes. Number two, the robot is built with artificial intelligence that allows it to do a few different things. Number one, it scans the entire area when it's extracting the hair. It scans the whole back of the scalp, and it calculates the exact distance between each hair follicle. The goal is that it takes the hair follicles out evenly throughout the entire back of the scalp, making sure that at each and every extraction point there is an equal amount of surrounding hair, so that you don't end up with a moth-eaten type look like you can end up with when a surgeon who's looking under the microscope and the loupes and is focused on a small area can leave, where he leaves or she leaves patches here, there, etc. The hair is 100% evenly extracted. Finally, the Artas robot that we use is connected to all of the Artas robots across the world. And every night, the Artas robot pushes the data that it collected during the transplantation procedure to the cloud, and then re-downloads the data from all of the other robots around the world, so that each and every day it's machine learning and getting better and better and better. That way we know that each transplantation is better than the previous one, and that on the morning of your transplantation, you are literally getting the world's best technology that day.
So after the Artas robot extracts each follicle, we have a technician that looks at each follicle under a microscope, sorts them out, because each follicle could have 2, 3, 4 hairs. So we're gonna separate them, get the grafts cleaned up, keep them hydrated, clean them up, and get them ready for implantation.
And that's key, because when we talk about grafting 2,000 follicles, 2,500 follicles, 3,000 follicles, the reality is it's not 2,000, 2,500, or 3,000 hairs. Because each follicle can have 2, 3, or 4 hairs, 2,500 grafts can be 7,500 hairs, can be 10,000 hairs that we're actually transplanting to the front of the head.
Good point. So while we're sorting the hair follicles, we're going to give you a quick break for lunch, and then we're going to spend the second portion of the day making the sites and implanting the hair, which you'll be watching Netflix throughout that portion. So we'll be done with the procedure early afternoon and send you home with some really detailed instructions about how to wash your hair, when you can work out, just really how to keep those follicles hydrated. And then we're here to answer any questions you have throughout, the several days afterwards, post-procedure.
From a pain perspective, what we find is that most patients take maybe one pain pill the night of the procedure, and about 50% need to take one the next morning. And then after that, just Tylenol, etc. is fine. And they're comfortable enough to resume daily activities, going back to work without restrictions.
So when you do a transplant, the full results is going to be 1 year out. Usually the first couple of months, you have the shock loss where some of the hairs are falling out and growing back, a little bit frustrating. Usually at about 4 to 6 months is when patients are like, okay, all my new hair is growing in. They're getting excited, but a year out is the full result of it.
The biggest thing to know about the Artas hair transplantation results is that the results are permanent. And understanding why they're permanent is critical. So when we look at the cause of hair loss to begin with, and male pattern baldness, and even female pattern for that matter, what happens is some of us are born with an enzyme in our hair follicles that converts testosterone to dihydrotestosterone. And the dihydrotestosterone causes the tiny blood vessels that run to the hair follicle to clamp down, literally strangling the hair until it thins, falls out, and dies. But what's very interesting is that enzyme only lives in the hair follicles in certain locations for people. So that enzyme doesn't live in the follicles on the side or the back of your head. And so when we take the hair follicles from the side or the back of your head and we translate them up to where your hair loss was, those hair follicles that we transfer then to the front of the scalp don't come with that enzyme. And so they are going to be resistant to hair loss over the years. So the results of the Artas transplantation are permanent. Now, all of that being said, it's critical that we protect the hair follicles that were already there so that we don't have a situation where we transfer all of these hair follicles that live, but then the existing ones eventually fall out as your male pattern baldness or female pattern baldness continue. So how do we protect those hair follicles? Let's talk about it. There are a few big things we're going to ask you to do at home to protect them. First, minoxidil. Minoxidil is a shampoo or a topical agent that you will put on your scalp. What minoxidil does is it literally opens up the blood vessels. In fact, small aside, minoxidil was originally created as a medication to lower blood pressure. And it worked by opening up blood vessels, thus decreasing the blood pressure. However, what they found was the side effect is everywhere where people rubbed the minoxidil on, they got really hairy. So obviously nobody wants to use it for blood pressure anymore. But if we put it just on the scalp, we know that we can increase the caliber of your hair, increase the density, the thickness there by promoting the growth of the hair that used to be there. Second thing we're going to ask you to do is Propecia or finasteride. Okay, finasteride blocks the enzyme that converts that testosterone to dihydrotestosterone, thus preventing the choking of the existing hair follicles. The key here is protecting what is already there so that the new transplanted hair really starts to look great. Third thing we're going to ask you to do is PRP. PRP is platelet-rich plasma. And so many of us are familiar with PRP from the orthopedic side of things, where people inject it into the knees or the shoulders of athletes that have worn down their cartilage or have cartilage injuries, etc. Well, the reality is PRP is a natural healing substance, platelet-rich plasma, that we find in our own blood. So what we do is we will extract some blood from you, we'll spin it down, we'll purify it down to those growth factors in that PRP. And then what the study shows, if we inject it into the scalp, typically 3 times over 6 months, once 6 months after that, and then annually after that, those growth factors will stimulate the existing hair follicles to grow thicker, richer, and again, make the hair transplantation look that much better. Finally, red light therapy. Red light therapy is going to literally help dilate the blood vessels, which again augments that blood flow, fights against that dihydrotestosterone, and helps protect the existing hair. There are also some fantastic vitamin supplements you can use, including Nutrafol and some shampoos like Therapy, which can also augment your result.
I'm Charity, and this is Dr. Obaid at North Texas Plastic Surgery. If you have any questions or would like to learn more about hair restoration, please give us a like, give us a follow, or send us a message in the DMs.
We can't wait to see you. Thanks.